Are you ready to find freedom from feeling like your child's bedwetting is something that they're doing on purpose or maybe just not cooperating with you? Dr. Phyllis Bogopa is here to help bust a few myths that parents often carry about the idea of bedwetting. Welcome to Mums at the Table, Dr. Phyllis.
Oh, thank you, Rachel. Thanks for having me.
Can you bust a few myths for us parents and give us some freedom around this idea of bedwetting?
I hope so.
Yes. So what are some things you see patients come into your office either believing or complaining about with their children that you just want to tell them that's just not true?
One of the common ones that I want to just get straight out is laziness.
Okay.
Often families feel that a child is wet in their bed because they are lazy.
And you're saying it's not true?
Absolutely not. Okay. Most children who wet the bed, sometimes there's a family history. One of their relatives or older siblings has wet the bed themselves.
Okay.
Or they could be just a heavy sleeper and is not able to rouse when the bladder is full, so they're not getting those cues for a full bladder. Sometimes there could be medical reasons why it's happening, and there's quite a number of them. One of them could be, they've got constipation, which is just worsening that bedwetting.
Oh, that's interesting. So there's a link between constipation and bedwetting.
Yeah, absolutely there is. And we can also have, say, a child who's been dry for some time and is suddenly wet in the bed. There could be other reasons. It could be because they've got a bladder infection or they've got something even more serious like diabetes.
So those are the times that maybe we should go and get the medical intervention and ask more questions. Is that what you're saying?
Absolutely, for those reasons. But even if a child has just been wet in the bed and has actually never had a dry bed, if they're around, let's say, maybe about after 6 or so, and they're concerned or they're really keen to get dry, I would get that child to be seen by a doctor to help them get dry.
Okay, and you're saying keen, so the child needs to be part of this process.
The child's going to absolutely be part of the process because it's a family effort when it comes to getting a child dry. The child needs to be on board because the treatments that are used, you're going to need the child to be part of it.
Okay.
Some of those include using an alarm, obviously after looking out at the underlying, if there's any underlying medical conditions. But before we even get there, we sometimes get a child to drink water.
Oh,
drink more water.
So drinking water can actually help with bedwetting?
That's absolutely true. What you want to do with water is that if a child has actually drunk and well hydrated during the day, they won't be as thirsty when it comes to the evening. They may, of course, have a little drink, but they're not going to be guzzling up a lot of water.
Okay.
And it also helps with the bowels, helps with that constipation. But the other thing that it does is that, the bladder is actually a muscle, just like a balloon, so it kind of expands and stretches out when it's full.
So we need to strengthen it like a bicep, for example.
Exactly, that's right. That's what we're doing when we're getting the child to drink more. There's also medications, if indicated, depending on what is causing the bedwetting.
Well, thank you for providing us as parents a little bit of freedom. If you like more tips like this, please join us on our website, mumsathetable.com.